Hi, Dr. Andrea Maxim, naturopathic doctor and the creator of the Maxim movement. And the main reason why I wanted to make this video is to discuss acne and how you can start to clear your skin. And the reason why I felt it to be so important is because I've been getting so many young girls and middle-aged women that cannot seem to get their skin cleared. And by those ages, we should be starting to see some improvements, some more stability with our hormones. And so I wanted to give you a few ideas of what to look out for, as well as a few treatment ideas that you can start doing immediately to start clearing your skin. And I'll first start by saying I definitely grew up with bad skin, and I grew up in the age of Accutane, where that was the first thing that we would be prescribed in order to start clearing up our skin, and it definitely did work. But of course, with being on the birth control pill, coming off the pill, everything kind of goes haywire again. So I've had my own skin struggles for sure. But what I will say is, by following some of the tips that I'm about to describe, I have been very successful at keeping my skin nice and clear, and I rarely now ever get a pimple unless I start going against some of my personal dietary issues, or if I slack a little bit more on my hygiene protocol. So some of the things that I want you to think about, and I really want to always go back to my 4-tiered approach to health. So when it comes to removing the triggers, the most common triggers that I find, especially if the acne is more pustular, so it has the whiteheads, is dairy. And it's simply because dairy in and of itself is very mucus forming. And so, of course, the more mucus you consume, the more it's going to seep out onto the skin and create more of those whiteheads, or pustular lesions, we call in medical jargon. The other foods that I've noticed to really trigger acne are the ones that are high in sugar. So again, if you're eating a very carb-heavy diet, or if you're having a lot of sweets in your diet, this is really going to go against what you want to do with regards to achieving clear skin. So both of those items I would definitely remove for a minimum of 4 weeks and see how your skin starts to clear. But it's not just the food triggers that you have to be worried about. I've also seen underlying infections be an issue with regards to skin issues. So it could be yeast overgrowth or parasite overgrowth. So you want to make sure that those things get established. In my office, we do comprehensive stool testing or live blood analysis to see if those infections are present. And generally, once we clear them out, clean up the diet, the skin starts to follow. But when it comes to the second tier, which is detoxification, we have to remember that whatever shows up on your skin is generally a reflection of what's going on inside the body. So remember, your liver is your main detoxifying organ, and everything you get exposed to, food, drink, environmental, all has to go through your liver in order to be metabolized or excreted as waste. And then that's, of course, when you have your bowel movements or you go to the washroom and urinate, that you're getting rid of a lot of those toxins. So if you're not having regular bowel movements, that has to be adjusted. But I also find a big reason why people are chronically constipated is because their liver is so bunged up, if I can say, and their liver is just not being able to remove those toxins as well. From a hormonal perspective, because again, we find a lot of acne lesions start to come up during your menstrual cycle, or when you're stressed out, or during puberty is the most common one. The hormones have to be metabolized through the liver as well. So if your liver, and imagine kind of a big boiling pot, if that pot starts to boil, eventually it's going to boil over. And so we want to start to manage what your liver is being exposed to so it can start to filter things out a lot better. And then the skin, again, of course, won't have to take on a lot of the extra waste, because your skin is also a huge elimination organ with regards to toxins. And then the third tier that I mentioned is acid-alkaline balance. And if we are not alkaline, that means that our body is a lot more acidic. And when the body is acidic, it's very inflamed. And when we have inflammation, we get those big, red, cystic, painful lesions start to come up on our skin. So the more greens that you can incorporate into your diet, figuring out what the triggers are of that acidity, and for a lot of people it's the wear and tear during the day, it's stress, it's eating a predominantly beige diet and not getting enough color in. And these are all things that you really need to become very cognizant of to pay attention. Okay, when I do this, I get an acne pimple by the end of the day. Or when I eat these foods, then it triggers acne. So these are some of the triggers that I want you to think about. Again, those are removing gluten and sugar. We want to keep the liver nice and clean, so doing a good detox. My 7-day detox is really wonderful at getting people started, and you can look at some of the videos on my 7-day detox on this channel. And of course, you want to be making sure that you are eating and being as alkaline as possible and trying to minimize a lot of those stressors. Now, with regards to treatment, a lot of people start reaching for the chemical-laden personal care products. So we start doing the Neutrogenas and the Proactives and all those other companies. And unfortunately, for most people, they say their acne only gets worse. And the reason why I believe that to be the case is, number one, they're kind of going against the whole hormone balance idea that we'd like to maintain. Remember, the more we clean up the inside, the more the outside starts to look good. And also, you're putting a fair amount of chemicals onto the skin, and we want the skin to be nice and clean. It's actually better for you to cleanse less and use less on the skin and allow it to breathe than it is to layer all kinds of creams and lotions and other things onto it. So I encourage you to try to minimize your hygiene protocol. Of course, if you're getting sweaty and grimy and disgusting, you want to clean that off. But definitely getting into a nice exfoliation routine once a week would be just fine to clear out some of the debris on the skin, or booking in with your favorite all-natural esthetician to have her clean up your skin for a nice facial, which is always a nice treat for everybody. But with regards to treating the skin, topically, I find castor oil to be very effective. Topically, for those kind of spot areas, go to bed with it on. Castor oil is very irritating to the skin, so it allows fresh blood flow to come to the surface and kind of clean up a lot of that debris that's found inside the pimple. You may also want to use something that's high in vitamin A or vitamin D topically on the skin. Both of those vitamins are incredibly nourishing to the skin, and you can do those in drops orally or definitely a topical serum. With regards to liver detoxification, I mentioned my 7-day detox, but anything that you can do to detoxify your liver. Lemon and water is a wonderful option. Herbal teas like dandelion root tea or burdock tea are wonderful for cleansing the skin and cleansing the liver. Milk thistle is a really common one, but you have to be very consistent if we're doing the teas. They're not as strong as what you can get with a botanical tincture or a capsule. And then, of course, we want to, again, consume lots of those dark leafy greens. We want to maintain a nice alkaline body. And this benefits you well beyond your skin. It makes everything work so much better when we put the inflammation out. And then when we're talking about healthy oils and nutrients, fish oil is really a must. You need to be getting at least 850 milligrams of EPA into your supplement regime every single day. It's amazing what it can do as an anti-inflammatory, is providing the skin with some nice clarity. It's also great for mood and brain and everything else. So these are just a few tips, things to think about with regards to avoidances, things to think about with regards to what you need to add into your diet and into your supplement regime. And I hope that after 30 days of consistently doing this, you will be just like me and notice that your skin is getting so much clearer and that the acne lesions that return are much, much less and eventually non-existent. We want you to be as healthy on the outside as you are on the inside. And as always, I love for you to maximize your health. Please consider subscribing to this channel so you can get notifications every time I post a new video. If you have ideas for topics, please don't hesitate to put them in the comments section. And as always, have a happy and healthy day.